Welcome back. South Africa has clinched another first on the continent, this time in making robotic lung and heart surgeries available. A cardiothoracic robot-assisted surgery program has been established at the Netcare Christiaan Barnard Hospital in Cape Town. The service will provide less invasive alternatives for surgical procedures in the chest cavity without splitting any bones. For more on this, let's bring in cardiovascular and thoracic surgeon Dr Johan van Merwe. Doctor, thank you so much for speaking to us this evening. So first of all, what is robotic heart and lung surgery and how does it work?
Thank you very much. Good evening. Very nice to speak to you this evening. Only just in short, so robotic surgery is basically the normal cardiovascular and lung surgery that we would offer any patients. But we perform it now with state-of-the-art robotics technology, which basically consists of a robot that's at the bedside of the patient, of the operating table, and then a surgeon that sits at a console a few meters away from the patient. And we use that console to basically function as an extension of our hands with fantastic tactile feedback and excellent three-dimensional vision to perform exactly the same operations that we would usually do, just with smaller cuts and being less invasive.
Now, Doctor, we're going to talk about the procedures in just a little bit, but just from a curiosity point of view, it always obviously takes a lot of dexterity, technicality and finesse to be a surgeon in the first place. Tell us about how performing surgeries through using this robotic technology is different.
Well, I think only the most important thing is you need to have a very solid base in the discipline that you work in. Nobody's going to start off being a robotic surgeon without having the basics well mastered. But it is an intense training period on the robotic simulators. I think the important thing for me this is a big team effort. And it's not just about a surgeon having the skills, but actually a whole team that grows and develops with the surgeon in ultimately developing the skills to offer this service. It's a long road, it's a challenging road, but at the end of the day, we hope our patients benefit from these sort of state-of-the-art technology.
So your team is the first offering these kind of surgeries on the continent. So what procedure was the first performed in South Africa?
Yeah, so only what we set out to do is to establish a safe and a sustainable program in the long term. And, we have to be very careful as to what sort of cases we start off with. And we decided to start off with low-risk patients and low-risk sort of surgeries and operations. And the first case we did was a patient with what we call thoracic outlet syndrome. And that is where the nerves and the vasculature of the upper limb is compressed between the collarbone and the first rib. This patient had extreme discomfort, especially from a professional perspective as well. And what we did was we resected that first rib and all the attached muscles, and we freed the nerves and the blood vessels completely from where they were impinged, with the intention of having a nice functional upper limb, and for this patient to regain his functionality and to do what he likes to do from a professional perspective as well. And grateful it went very well, and we're very pleased with the platform that we created for more complex cases now.
So tell us about some of those more complex cases and the other kinds of operations that can be performed using this surgery technique.
Like I mentioned in the beginning, any open heart surgery, or actually the majority of cases that we would do with open heart surgery and open lung surgery can be done with a robot. I think the most common application of robotic surgery internationally is in lung cancer surgery, where in the United States, for example, more than half of lung cancer surgeries are being performed with robotics instead of the classic open ways or the less invasive endoscopic ways that we've been trained in. And from a heart surgery perspective, the big application of robotic surgery is in coronary artery surgery, where we, with very minimally invasive techniques, harvest important conduits from the chest that we use then to bypass blocked blood vessels on the heart itself. And, this is technology that's rapidly developing, and we're looking forward to an exciting future in robotic surgery internationally.
What are some of the advantages for patients?
There's a lot published on this, and there's multiple scientific meta-analysis on what the benefits of robotic surgeries are compared to the classic ways that we've been doing things for many years. And some of these advantages include obviously smaller incisions, less invasive sort of reactions to big surgeries. The majority of these patients recover extremely fast, with hospital discharges usually occurring within a few days. Very short recovery periods. And while in hospital, especially from a heart surgery perspective, we know there's less blood transfusion, less blood requests, blood tests required, less imaging stays required. And these patients tend to do relatively well in terms of a recovery period compared to the old classic ways of how we do things.
Given those advantages, I'm sure everyone's going to be clamoring to rather have less invasive surgery than being sliced and diced. So what kind of volume do you foresee in the future, and given that it's surely not an option for all cases?
Only I must just emphasize, that the classical way of how we operate is still the gold standard, with excellent outcomes and fantastic patient benefit per se. But with robotic surgery, obviously, from a first world perspective, this is the way to go. But we do have challenges within our continent and within the South African context. And one of those challenges are obviously cost, because these are very expensive technologies. And the major obstacle will lie with healthcare funders also sharing our enthusiasm of offering state-of-the-art technologies to our patients in South Africa. And the same also in the public sector, we will all try to be involved with as well and serve our communities. So sort of volumes, and that's difficult to say. We wish that we can offer robotic surgery to everybody. But there are some constraints, like I said, from a logistical perspective, from an infrastructural perspective, and cost. But at the end of the day, we see it internationally that there are many more industry role players entering the field of robotic surgery, which would definitely in the long term bring the costs down. And, with the development of new teams and skill sets amongst our surgical colleagues and everybody who's enthusiastic about minimally invasive and robotic surgery, this is definitely a technology that we can offer a large portion of our population in the near foreseeable future.
The technology advances incredibly quickly these days. Before something has even become the norm, there are 10 new methods to replace it. So what kind of a big step is this in terms of access to the latest technology in South Africa?
Yeah, look, and I think we're extremely grateful, from our perspective, to be able to collaborate with fantastic colleagues and friends and mentors abroad. I think this is a massive learning curve for everybody initially, and as you become more comfortable with the technology, the more expansive you can become with what sort of procedures that you offer. But I do think, from a starting off perspective, we've planned this extremely well. There was a lot of risk reduction strategies in our initial build-up to where we've reached a phase as a team to say, look, we're ready for this. Let's go ahead and let's do it. And, we're looking forward to offering this service now to whoever is seen as a candidate for robotic surgery. And we're looking forward on building on what we've established, and also for our colleagues across the country to progressively start introducing these sort of technologies into their private practices and in the public sector as well.
Well, the future of medicine is certainly exciting, if that's anything to go by. Thank you so much for speaking to us. That was Dr. Johan van der Merwe coming to us from Cape Town.